We are live.
All right. Well, Happy New Year to our Mesa Public Schools community. I'm Andy Forlis, a very proud superintendent of this amazing school district. And I want to say thank you very much for joining us on our weekly Facebook Live session. It's over our 2 weeks of winter break. We haven't been with you, so we feel like we've missed you a bit. So, welcome to those of you who are able to join us this afternoon. We've got a couple of big topics that we want to talk about. We know that we are currently in a 2 week remote learning environment, and our first 2 days were a little glitchy in the world of technology. So, Mrs. Helen Hollins, who is our Executive Director of Information and Outreach, will be here to talk about some of those glitches. And then also a very friendly face on our Facebook Live series is our Associate Superintendent, Mrs. Holly Williams. And together, Mrs. Hollins and Mrs. Williams make up part of our coronavirus tracking team. And so they work very closely together. And so they are the right people to be here to answer any questions that you have about the most current events that are occurring within COVID-19, the world of COVID-19. So we are going to get started today. Again, I want to say Happy New Year to you. Thank you for joining us. We are glad that you're able to spend time with us. So let's start off with that with technology. So Helen, as a district, we use WebEx, and WebEx is our virtual communication that we use, as you well know. And so you and your team have been working really hard to make sure that the internet is working as well as our WebEx device. So if you could talk to us a bit about where the challenges came up.
Sure. As everybody knows, technology systems are complex and they're multi-layered, and every layer has and successfully for us to be able to deliver the technology experience that we hope to for everybody. And what happened on Monday is we had several layers have some consequences that together made for a poor experience. And the layers that we had that were impacted on Monday were some in-house in Mesa Public Schools and some external. So Cox Communications had a few issues in providing internet service to their home customers. So some families were seeing their issues due to their internet provider. What we didn't realize at the time, but once we were able to work with Cox, was that we were also experiencing a second layer where our WebEx service was not performing adequately. And the easiest way to explain it is the system was trying to put way too much communications down a very narrow tunnel. So if you were lucky enough to be in the center lane and get through that tunnel, no problem, you had a great WebEx experience and you had audio and video and were able to communicate well. But if you were caught in those outer lanes, you got bottlenecked and you either had video problems or audio problems. So we had our tech teams obviously on that. As soon as we realized what was going on, we use a consultant to help us when necessary to work towards coming up with a solution. And of course, the vendor of WebEx was right there with us, working pretty late into the night yesterday, where they finally were able to discern what changes we could make in the system that would alleviate the issues. Those changes were made, and the experience today was much better. We are obviously continuing to monitor it, tweak it, and confirm that the changes are permanent and that we won't experience those occurrences of bottlenecking again. But it was kind of a perfect storm for us in that multiple things happened all when we came back, and that caused the less than great experience technology-wise.
So thank you, Mrs. Holland, and thank you to our community for being so patient. Certainly was not by design, and we had teams working really hard and collaborating with our vendors to make sure that we had a better experience today. So thank you again. You will see that we are joining remotely from our homes because we realized that that was a way that we'd have a better experience just in case there were still problems. So thank goodness we will be back into the office tomorrow knowing that we've got adequate service. So moving on, I know that both you, Mrs. Hollins, and Mrs. Williams work really closely on the team when we decide what learning model a school will be in. And we have communicated with our families and with our staff that on January 14th, we are going to identify the learning model for each of our 85 schools. So the question that has come up is, how will you decide which school is in which learning model? What is that going to look like? So, Mrs. Williams, if you don't mind taking that.
Sure. Thank you, Dr. Forlis. We have we have a robust system of collecting the data around what the specific items have to do with testing that are coming in for both our staff and our students. And so we are collecting that data as one of the data points that we will use to make those decisions. Of course, we will use our community data and conversations with our principals and the information we get from the county and the state. We work closely with our Maricopa County partners, the state of the Arizona Department of Health Services, and also ADE to make those decisions. But for our schools, we are saying that it'll be school by school, classroom by classroom. So the most important data that we'll be using are the reports that you submit to us around testing in your homes and with our teachers and staff members. And so we are having great success with that right now. We are seeing lots of those reports coming in from the testing that happened over the holidays and even in the last couple of days, that those reports. And so I'd like to thank folks for making sure that they get that to us, because that will help inform our decisions and make sure that we're keeping our schools and our departments as safe as possible. So we will be gathering that information and making those decisions next week and informing everyone the status of their schools on Thursday afternoon.
You know, and I think that we've talked a lot about in these Facebook Live sessions that some people are looking for numbers. Tell us the number. How many cases at a school qualifies for which learning model? And what we have learned about this virus and what we've learned about making decisions is that there's a story behind each case. And so the work of Mrs. Williams with the principal at a school and that leadership team is to learn more about how is COVID showing up and behaving in that particular school or in that particular classroom. So we could come up with a number, but that number is not going to tell us enough about the decision that we need to make. So for example, we had an elementary school right before break that had 4 cases that came up. There was 0 cases in the school, then all of a sudden it was 4. Well, those 4 cases was one employee and her 3 children that all attend that school. And there was 4 positives. It was in one family. It was isolated to that family, and they had not been on campus. So that's very different than 4 cases in 4 separate classrooms or 4 cases of kids that are unrelated in the same classroom. So again, it's digging in and hearing the stories behind it that help to guide our decision. So I know that that's not the answer that satisfies a lot of people, but I want to make sure that we're very consistent in what we're sharing, because it's truly decisions made by schools. I mean, made by in the decision about the data and how it shows up in the school. And we had a study session with our governing board last night, and Mrs. Williams reminded the governing board that when we make a decision, a school may open up to 5 days of modified in-person learning, but there could be a classroom at that school that is remote. So if it is if we see spread in one classroom, we don't believe it is the right thing to do to have the entire school in remote learning. Just
We
wanted
might
to
also see
clarify
that. I want to add to that. We could see it with a sports team or
Yes.
an activity group, especially because our sports teams have been practicing through the break. And so they would have had exposure to each other. So there may be some circumstances where a school opens, but we have a basketball or a wrestling or, a team that ends up being isolated, but the school themselves would not be closed. The students impacted would be.
Excellent. So let's talk about testing for just a bit. If my child received a positive test result during winter break and their quarantine will end before January 19th, do I still need to report this to my school?
Oh, great question. Yes. Yes, please. And let me tell you what the benefit of that is we talked about it on our last Facebook Live, and following CDC and Maricopa County guidance, this isn't a Mesa Public School made this up. It is believed that it's highly unlikely that a person who has had COVID within 90 days, there tends to be an immunity. And it's highly unlikely that they'll get it a second time in those 90 days. And so we are collecting that data so that we don't exclude students who have recent COVID diagnoses and they have recovered in a quarantine. So let's say at a high school, we see a basketball team, for example, that maybe we have to quarantine because of close contact. But one of those members over Christmas vacation had COVID, and they're back and they're well and they're doing well. We wouldn't exclude that person because they would be in their 90-day window. And that's why it's so important that we have all of the data so that we can make the best decisions and keep as many students in school as possible. Because we know we've had a number of students who've tested positive over the fall semester. And we want to make sure that we have kept that data so that we can accurately put folks into remote learning when they need to be, but keep as many in person as possible. So yes, it's a benefit to the student, and it's such important information for us to have. So please report those to your school nurse, or you can call the attendance line and they will get you to the right person.
Thank you. And it's also important to know that the Maricopa County Health Department sends us data on positive cases as well, but the information coming directly from our employees and our families is far more timely. And so that will help us to make better decisions as well. So we just really appreciate that. So let's talk a little bit about vaccines. So a big question that is coming out in the world of education, we just got a lot of communication coming our way between last night and this morning about vaccines for educators and those who work in the K-12 education space. So can you talk about when these are going to be available for our staff? What do we know so far? And so maybe if you want to take the lead on that, Mrs. Williams.
I sure will. We're excited to announce that the Maricopa County released the information today about the vaccines available for our education team, which means anybody involved in our organization, anybody with a Mesa Public Schools badge is eligible in this next phase, which is called 1B. If you hear it on the news and you hear, okay, 1B is starting, that's us. We raise our hands and say, okay, that's us, that's educators and those associated with the education institution. So what we learned today, fresh off the presses, is that on Monday, the site will open for pre-registration. So any of our employees who would like to get a vaccine can go on Monday and log into Maricopa County, and we provided the link with them for them this afternoon so that they could pre-register and that they could find sign up for a time. I think there's a couple of screening steps that happen if we watch what happened in Section 1A. There was a pre-screening, and then they did a priority list, and then they scheduled folks. I anticipate similar process for 1B, and the county handles that part. And there are 5 points of distribution through Maricopa County where folks can sign up to get those tests. So we have sent the information to all of vaccines. I did that again earlier this morning. I'm sorry about that. Test vaccines. Vaccines are available in 5 locations throughout the county. And so we are encouraging anyone who feels that that's something that would be good for them to do, that's something they should sign up for. So we are excited to announce that. And we are looking for ways to partner to bring some of those opportunities to Mesa. So stay tuned for more information on that. We don't have information on that yet, but we are working hard to make more vaccines accessible to more people here in our community.
And just an interesting fact, I spent some time on a virtual call today learning that there are plenty of people to deliver the vaccines. And what the slowdown is the paperwork, the screening, and just the administration of the vaccine, and that seems to be a larger demand than there are vaccines available at this time. So we will continue to watch this and keep our community and our staff updated as they become available. There was another question about when students and families will have access to these vaccines. The current plan for rollout, we would estimate that it would be spring or summer before the vaccines are widely available. So we know that our frontline healthcare workers and our first responders have received the vaccine in 1A. We're 1B. We're thrilled about that because we want to make sure that as Mrs. Williams said, our staff gets the vaccine for those who believe that it's the best decision for them.
Dr. Furless, I'd like to share that if folks would like to see a timeline, the Maricopa County Department of Health Services has a great graphic on their website for COVID vaccines, and it lays out those priority groups and an estimated timeline. Again, as you said, the accessibility of the vaccine is one of the challenges that the state is facing, how many we can get. And the fact, you brought up a great point about the paperwork, because we have to remember that everyone must have two, and you have to have two of the same vaccine, and you have to go back to the same place. So there's a lot of tracing and documenting that has to happen to make sure that folks get what they need and that they get the appropriate dosage, so that you take one from one organization and another from another, they won't be covered. So it's really important that they get the documentation accurate. And so I have heard the same, that the delays happen because of making sure that we are being precise and keeping folks safe and healthy.
Excellent. And so we're talking about providing continued information, and I know how important that is. Mrs. Hollins, as you lead our communications team, can you talk about how important it is to make sure that we have updated information for all of our employees and all of our children?
It is imperative that a phone number or an email address that you alert your school to do that happened. For parents who use our parent portal, the app or the portal for viewing their children's grades, you can actually submit a new phone number or your new email address directly through there, and then it is approved by the school and enters into our student database. For our employees, you can do that through the self-service portal for Visions. You can update your contact information, both for your email address and your phone number. For employees, we highly encourage those that do not look at their work email on weekends or on days that they are not actively working, that they use a personal email address as well. That especially comes into play for workers who perhaps don't have a 12-month contract. You might miss an important piece of information if we only have your work email address to send it to. The other thing I would highly encourage everybody to do is to opt into texting. We send out information about that regularly. I believe it's also on our website. We'll make sure we post it here on Facebook in the next day or so, in case you don't have the information. But if you opt into texting with us, then every time we send a message out, you'll get a text message as well. And the last thing I would encourage you to do is, I know sometimes people think we over communicate, and I apologize for that. I apologize if you only wanted the text and you really just wanted the email. You actually do have some ability to control that through the school messenger app that we use to communicate with. We'll get that information out as well. The last thing we want you to do, though, is to unsubscribe from messages that come to you from Mesa Public Schools, because once you unsubscribe from one, you have unsubscribed from all, and we would need to go back in and resubscribe you. So I would rather you filter us out than unsubscribe from us, just so that you know that the important messages will come through.
So speaking of important messages, January 14th is going to be an important day, because that is when we are going to identify the learning model for each of our schools. And when we talk about learning model, we're talking about whether a school will be in remote learning, whether they will be in 2 days of modified instruction or 5 days of modified instruction learning. So Mrs. Hollins, can you talk a little bit about how we are going to communicate that, and how our COVID-19 dashboard is going to look differently?
Sure. So as you know, we've been running a district dashboard since we went to modified in-person learning. And on that dashboard, we report the active cases on campus in the last 14 days. And that was aligned with the quarantine timeframe for a person who had been exposed to COVID-19. And it was aligned to the individuals that were actually on campus. In December, the CDC, state, and county adjusted quarantine time to 10 days. So when we reinstitute the dashboard in January, it will have a 10-day window that you will look at. And that is because the main purpose of our dashboard is for an individual to understand what the possible exposure was on a particular site during the time frame that it was potentially an active case. So one of the things you will see is that time frame will change. The second thing we are going to do is we are going to use the dashboard to also share what learning model a school is in. That was not a feature of the dashboard during first semester, but it will be an added feature for second semester. It will be done through a color coding system so that it is a quick visual. As you look at the dashboard, you will see that schools will either be white, light blue, or a slightly darker blue, depending on whether they are in a fully remote model, which would be the darkest blue, because that would be the most change to learning model that we would want to see, a 2-day or a 5-day, with the 5-day being the standard white background, because that is our preferred model at all costs if we can be in that model. When we open up the dashboard, the first 2 cycles of the dashboard in January will be transitional. Because we will have to use data that was when we were in fully remote. And if you think about it, if students are remote, we don't normally report them on the dashboard because they weren't on campus and they didn't expose the school community. However, that's the only data we have. So to counteract the possibility that we may have less reporting than is typical during remote, but now that Mrs. Williams has spoken to you, I know everybody's going to actually report their cases. We will be reporting all cases during remote learning. So if we had a positive case reported in that time frame during remote learning, it will show up on the dashboard. And then once January 19th comes around and we go back to in-person, we'll again only report cases that were on campus. That communication, so that'll be the kind of the font of all knowledge. If in doubt, you want to know the learning model for your school, go there on January 14th, and that's where we will post it. The district will also send out a full district-wide communication driving you to that, and then we will encourage each school to send out communication that specifically tells you what the learning model for your school is. So hopefully by tiering and layering that communication, everybody will get the information timely and in the format that they are most used to getting that information in, and from the people they trust to get information.
Excellent. Thank you very much. So new improvements coming to the dashboard, sharing more information. So our next question is about preschool. Why is preschool and special education starting on Monday when the metrics call for all remote?
That's a great question. Governor Ducey, in his executive order that was issued in August, I believe, said to us that couple of things. One, we had to provide on-site support centers, which we have been throughout. Anytime we are remote, we offer those. The second thing that it says is we must prioritize our high-risk populations, including special ed and preschool. And prioritize them for returning to in-person teaching as soon as possible. The metrics in the community, you're right, they would suggest, but remote learning. But currently, the new language around the metrics being provided by the state and the county says that the district can make school by school, classroom by classroom decisions, which is what we've been doing. And so we will be looking at the data for those programs before we open them on Monday and make sure that we have appropriate staffing and that we don't have a high number of cases in those classrooms before we reopen them. So we will do the same thing that we're doing next week for our schools to evaluate those programs to make sure that we can open them safely. But the reason that we're doing it next week is because of the governor's executive order prioritizing those populations.
And I think it's also important to mention that the Maricopa County Health Department has updated their guidance on December 17th they updated their guidance to say that if a jurisdiction, that would be a school district in the language that we're using, a jurisdiction can safely operate their school, that we can open up regardless of the community spread. Because what we have found out is that the cases of COVID inside of schools don't necessarily match what the zip code data tells us or what the trends in the zip code are. That's another piece of that data that we pay very close attention to when we are setting the most appropriate learning model for our kids. There was a question that was also came through, which was, where can you find that dashboard? So I know, Helen, you talked about the dashboard, and I think you've raised some interest. Where can they find it?
Excellent. Well, luckily we have Elliot monitoring that chat, and she has posted the link directly to the dashboard in the chat for you. But if in doubt, always go to the main page of the district website, mpsaz.org. We have a button there that's Safe, Strong, Ready, which is all about our plans to maintain a healthy environment. And if you click there, there's a button for the dashboard on that page. So go to Safe, Strong, Ready, and you will find our dashboard. And like I said, the link is in the chat right now.
Excellent. And is there any, I'm looking at our time, it's 4:26. We've got about 4 minutes left. If we've got any other questions that are coming through.
Dr. Forlis?
Yes.
I noticed there were several comments about attendance for the first couple of days of school.
Excellent.
With the technology. So I'd like to address that. So because first of all, yes, we did make a change on how we were taking attendance from first semester to second semester. During first semester, we were using students' logins anytime during the day into Canvas, our learning management system, as a mechanism to determine whether or not the student was present that day. We got quite a bit of feedback from our teachers that attendance really is typically their purview, and they felt strongly that it was important that they be able to indicate whether or not a student was present in their remote learning environment. So we did switch back to teacher-driven, teacher-led attendance taking for second semester. We communicated that out in December. I know I saw several flyers from individual schools go out explaining that for families, but we know change is always hard to kind of wrap your head around every once in a while. So because of the glitches on Monday and Tuesday, about mid-morning on Monday and early afternoon on Tuesday, the executive team, the leadership team got together, and we made the decision that we would not use students not being able to log into WebEx, therefore their teacher not being able to see them actively engaged in the class as an absence for them. So we marked all students as present on Monday and on Tuesday, unless a parent had called them in and excused them from school for the day or from that class. Now, some parents did get the morning phone calls. As you certainly elementary parents know, you get two sets of phone calls at elementary school, a morning call and an evening call. High schools only get an evening call. Juniors also get two calls. So some parents did get a morning call. And I know that caused concern because they were frustrated that their student couldn't get logged in. And then we were saying that you were absent. Please know those absences were cleared for Monday and Tuesday. And today we ran attendance as normal because we were not having technology issues.
Excellent. And we have another question that just came in, which is, how long will remote learning remain an option? So I just want to make, as we close up our time together today, we made a commitment at the very beginning of the school year that remote learning would be an option for our preschool all the way through our 12th grade students throughout this academic year. So remote learning is an option. We have sent out, families made their selections prior to this semester so that we could appropriately schedule and staff classes. So remote learning is not going away. It's always an option. even if a school is that we have identified that 5 days of in-person learning is the best learning option for them, families can continue with their selection of remote learning. We're not taking any of that away this year. So we have appreciated your time. Are there any last words, any last things that you feel that we should share with our community today? Mrs. Williams, Mrs. Hollins?
I'd like to topic jump for a second and remind folks that if you have a bachelor's degree and are willing to sub, we need you. So we have a shortage of substitute teachers, and I know Dr. Driscoll would be upset if we didn't bring that up, that we would love to have you. And so on the website to the Human Resources, there's a button for you to click if you'd like to become a sub for us. So I would encourage anyone and everyone who's eligible to come and sub for us. We could use your help.
And I have to brag just a little bit about Mesa Public Schools. We are the best paying district for substitutes. So you can't find a higher paying place for substitutes than Mesa Public Schools. We would love to have you. Thank you for reminding us of that. Anything else, Mrs. Hollins?
I'm good. Thank you for
update your contact information is what I thought.
Update your contact information.
Okay. Thank you. Take good care. Be safe. We really appreciate you. And thank you for all of your support. Have a great afternoon. Bye-bye.